Hi, I'm Rick Selby. Some of you may know me as your surgeon. Others may know me through the division or other faculty members. For years, I ran the division of abdominal organ transplantation and hepatopancreaticobiliary surgery. But I stepped down now, and within a couple of years, I plan to retire. There's an old saying that goes, if you follow your destiny, it will lead you, and if you don't, it'll drag you. So my destiny kind of dragged me to the Indian Health Service for a year while I was trying to figure out what to do. And then I was watching television one night. I happened to see Tom Starzl, who is the pioneer of transplantation, on an old black and white TV in government housing, and I was so charmed by him that I went to do transplant work at Pittsburgh. The big lesson for me at Pittsburgh was don't have any ceilings for your expectations, and I think that's an important concept to keep in mind as everybody goes through their life, but certainly as a physician, you don't want to have a ceiling set for the expectations of what's possible for a patient. I think that's one thing that was taught at Pittsburgh, and I try to carry that tradition. The most important thing is to take good care of patients. The second most important thing is to teach people to take good care of patients. And the third most important thing is probably to write about large volumes of patients that you've treated the same way and see what those outcomes have been and then publish them. So it almost transcends the individual patient in that it offers an opportunity for outside physicians and surgeons to manage patients the way that you manage them with an expectation of a better outcome. So we're really big on clinical research at our hospital. I would say that, nobility and excellence still exists in medicine in spite of all the struggles with healthcare costs and insurance and co-pays and authorizations. And that our mission here is to sort of develop the complete maturity of a tertiary quaternary level surgery program. And that complete maturity depends not on how much volume can we do, but actually how well can we care for the patients, and importantly, how well can we describe the successful outcomes from our patients so that those can further support the education of outside physicians and contribute to overall population health. We have the ability, and more importantly, we have the inclination to do the clinical research because it's not really compensated work. It's done after hours, and it's done as part of a mission completion for that holy trinity of patient care, which is individual patient care, teaching or education, and clinical research. I wanted to close this by saying that I am opening a legacy gift fund in the department. I'm hoping that I can get some of you to contribute and kind of pay it forward if you so feel obliged. I know that probably many of you have been helped and may want to help. For us, the ability to do clinical research is extremely important. It's not something that we get paid for. It's something that is a self-expectation, and we'd like to be able to continue it. So if any of you are inclined, please contribute. Thank you so much.